Hello, everyone. Nurse M here. I was just doing a little bit of Google and YouTube searching, and to come across some things to see if maybe I can find some information out there that's going to help our cause and get the awareness we need, especially in nursing homes and in skilled nursing facilities, to not only help our patients but also to help our ourselves. We have a very stressful work environment. And I just kind of wanted to go over a little bit of a tidbit of what I came across in a very, very short search. Y'all bear with me. I do have some comments with this. I'm using this under YouTube's fair use to be able to share with you what I have found. Okay, so here goes.
Americans living in nursing homes. And while it is the biggest change to regulations in 3 decades, many patient advocates say it still falls short of what's needed. Stephanie Sy has the details.
The COVID pandemic spotlighted how understaffing and low pay in nursing homes led to many tragic outcomes.
Okay, this is very true here. This has been the case since prior to COVID, but I feel like COVID is the thing that kind of brought this a little bit more into the limelight. But I also think that COVID caused great harm to working standards for nurses, especially in nursing homes and skilled nursing facilities, which is something that we're going to go into great detail with in the upcoming series that I have coming up. It's catastrophic on many, many levels, and no attention really is being brought to this. And if it is, it's sporadic and it's a one-time only thing that's being done. All right, let's go ahead and listen a little bit more.
With a disproportionate number of nursing home residents and workers dying. The new proposed rule calls for more nursing care, the equivalent of about 3 hours of care per day per resident, with 33 minutes of that care being delivered by a registered nurse, the rest by nurses' aides.
Okay, I just wanted to go over this a little bit. This is how the shady companies and nursing homes and skilled nursing facilities are getting away with this. That sounds great, right? Have about 3 hours worth of nursing care per resident. Wow, what a miracle, right? You'd be so wrong. I'm telling you, this is so wrong. What they do is they count any nurses that are in the building, not the nurses that are providing care, not the nurses that are running and dealing with 28, 38, sometimes 40 patients at a time. Oh, no, no, no. They're counting the director of nursing who's in the office doing paperwork. They're counting the nurse managers that are in the office doing reports. They're counting any nurse that may be an MDS for billing the insurance companies and continuity of care. All of that adds up into how many hours of nursing care somebody gets. So this 3 hours per nursing care per day per resident, any company can make it look like that is exactly what's happening. I assure you that it's not.
Currently, 3/4 of nursing homes do not have enough staff to meet these minimums. David Grabowski is a healthcare policy expert and professor at Harvard Medical School. He joins me now to share his reaction. David, thank you for being on the News Hour again. There are currently, from what I understand, no enforceable standards for nursing home staffing. Is it widely agreed that this was needed, and do you think it's enough to address the problem?
So I think it was absolutely needed. We've been talking about this as far back as the 1986 Institute of Medicine report. So this has been a long time coming. We've had a number of U.S. nursing homes that are understaffed, too much turnover, low safety, poor quality. Is it enough to the second part of your question? I don't think so. You said the numbers there, 3 hours per resident per day. These individuals are medically complex. They have.
That's something else that I want to bring to a point. They think that because it's a nursing home, these people are grandma and grandpa, and they're just living their best lives. They have a couple of medications, nothing too complex. They just need a little bit of extra help. No, ma'am. We have complex patients. And a lot of them have a lot of needs. Some even need one-on-one care, but they are all put in the same area with the same number of nurses, the same number of aides as everybody else. These are patients that need an extra level of care, and it isn't being done, which can have catastrophic outcomes, including falls, injuries, um, critical things being missed in their care, like a change in condition. Unless you know these patients and you spot something right away, it's hurry up, on to the next patient, on to the next patient.
Have a lot of functional limitations, a lot of needs. So 3 hours is a great start. The administration deserves a ton of credit for putting this rule forward. It's probably the biggest reform in nursing homes in decades, but we still have a ways to go.
But the reality is, as you know, the nursing home industry is already having a hard time attracting and retaining staff as it is without the standard. So even with this rule, can it be implemented?
Timing is everything, and we're in the middle of a staffing shortage, so this is a terrible time to...
Stop right there. Staffing shortage. Okay, let's explore this a little bit, huh? If you paid a fair wage for the enormous amount of work it is for a nurse to do, or for an aide to do in these complex patients, if you paid a living wage to these nurses, it would take a lot of outside stressors off of them. Number one, allow them to enjoy their days off if they get any. We'll get into some of that later. But, and it would also provide a stability to where you have continuity of care. And if you don't take care of not only the pay for these positions that are taking care of your mom, taking care of your grandma, your aunt, your uncle, you know, doing rehab for somebody that's outside of what the family can do. If you don't have enough nurses per patient, if the workload is too much, if there's too many patients for a nurse to be able to handle, if one little thing goes wrong, something horrific can happen. And if the workload's too much, you can have medication errors, missed opportunities to find something that's going on with the patient, whether it be an infection. I'm telling you, this has to be a twofold process. You can't just mandate something to where there's 3 hours per whatever. It has to stipulate where those nursing hours need to be spent. And it also has to put a much needed cap on the nurse to patient or CNA to patient ratios, period.
To implement a staffing standard in U.S. nursing homes. That said, it's never been more needed than it is today. So that's really the balancing act that the administration is facing. I think the administration built in a lot of measures within this policy to help out nursing homes that are suffering from staffing shortages in their local markets. So they've given any facility that can't find staff at the prevailing wages and they meet a series of criteria, they've been given an exemption under this policy.
Exemptions should not be given. This is a care issue. If you take a look at the VA or if you take a look at hospitals, it isn't anything abnormal, but these hospitals send these patients, very, very sick ones, to nursing homes. They flooded nursing homes with COVID positive patients. And that was in many, many states. They don't think of nursing homes and nursing home nurses and CNAs as being real nurses or real CNAs. It is fundamentally flawed, fundamentally wrong. A lot of us that went into long-term care absolutely love, adore, and cherish our elderly as beacons of wisdom for who they were and want to have time to spend with them. And nursing is more than just passing pills and changing bandages. It is so much more. There's a reason why the majority of us went into nursing.
They've also given a long implementation period to nursing homes, 3 to 5 years. And then finally, the administration has put $75 million into this growing the next generation of nursing home care.
Did I just hear $75 million? On what planet is that going to be enough money? It's just not. It's such a nominal amount of money. If you think about the care that our elderly are receiving and how complex their cares are and the supplies that are needing and the cost of everything, these companies find ways to hide these little monies that are given to them by adding on to corporations, which is something else that we'll get into in one of our next videos.
Caregivers. So is that enough? No, we need to figure out ways to grow this workforce. But I think these measures are a way to sort of help nursing homes that are really facing an unprecedented workforce shortage.
Part of the problem Biden administration officials have pointed to are private equity firms' buyouts of private nursing homes.
Bingo. Large corporations who know how to hide money and could care less about patient care, about the safety, well-being, and the licenses that the nurses and aides have under them that are writing on everything. They could care less as long as the big green's coming in. They don't care. They'll cut corners. The buildings will be falling apart. They'll say, oh, we were just fine. Yeah, no. If they think just bare minimum staffing, which is laughable, it is so dangerous, that's just fine. Yeah. Do a little research, y'all. I'll help you along.
They say that that's contributing to the staffing shortages because they imply those firms put profit over patient care. Have you seen evidence of that? Is that a big factor here?
I think that's a big part of the story. Ownership, we don't have a lot of those mom and pop owned nursing homes that we had 20, 30 years ago. These are corporations. They're often very complex corporations with many layers. And it's hard for policymakers to follow the dollars. And so many of those dollars don't end up in direct resident care. They don't end up in the pockets of staff. They unfortunately end up in other parts of the organizations through what are called related party transactions. So private equity, real estate investment trusts, and lots of other complicated ownership structures have emerged in this industry and really, I think, helped push along the kinds of reforms that we're now thinking about, like a minimum staffing standard, where I think 20, 30 years ago, we were talking about this policy, but it wasn't as needed as it is today because we didn't have the same set of owners that we do today.
And should the government be ponying up more money to pay nursing home staff?
If you talk to individuals in the industry, it's $1 billion question. So there are some nursing homes that haven't put enough dollars back into direct resident care. This policy will help discipline those nursing homes. They can no longer siphon off dollars away from direct resident care, those private equity groups we were just talking about. They'll have to put those dollars back.
I have got a new series coming out, or a new video, I should say, coming out about what these companies are doing with these funds in order to hide their profits. It's a good listen to, and take it from me. The people that are paying are the nurses that are out on the floor and those patients that those nurses care for. Now, when I say nurses, I mean all healthcare workers that are in these skilled nursing facilities and in these nursing homes. I'm not meaning to sound like this big, mean old nurse. I'm just lumping us all into one group and calling us nursing, okay? But these corporations are sneaky and they find ways of hiding monies. And like I said, we'll get into that.
Back into direct resident care. Other nursing homes may really struggle. I said earlier, this policy is hopefully a start. It's not just a start with staffing. I hope it's a start towards a more comprehensive set of reforms.
We will see. David Grabowski at Harvard Medical School. Thanks so much for sharing your expertise.
Okay, y'all. Like I said, this has been probably a project for me that I've been worried about for quite some time. And I do worry about this very subject comes up constantly. And what concerns me the most is nursing staff see the problem and they don't take any type of stand. They don't write their Congress people. I do. They don't, stop complying with the extreme workload. A lot of us took on a lot more than we should have during COVID. And I told my fellow colleagues, I'm like, if we continue to do this, you're going to think that this kind of staffing is okay and is going to continue. And sure enough, it is. I'd sure like to hear your thoughts and opinions on what's going on. And please, like I said, I'm a very small channel with a very short outreach. So if you could please leave a comment, like, subscribe, pass this information on. There's going to be more videos to come. Nurse Em out. Thank you.